All right, this is Mr. McMurray again, and we're going to finish up our notes and do a few things that Mr. McMurray forgot. He had this slideshow that went with this. Instead of showing you just a blank piece of paper, he could have shown you this. All right, anyhow, just for the record, when you're a baby, you have mostly cartilage bones with a little bit of calcium on them. When you were a fetus inside your mother at one time, you were all cartilage bones. And then gradually you get some bones, and then as you get older and older, the bone replaces, the calcium replaces the cartilage until finally you only have the growth plates and of course the cartilage on the ends of your bone and the growth plate down here, epiphyseal plate. And then eventually this will completely go away too and fuse together. All right. So there we go. We talk about axial. All right, axial is all the center. Then you have the appendages, so the appendicular is all the legs and goes off. We have long bones, irregular bones, flat bones, and short bones. We talked about those. Flat bones. The key thing about flat bones is they have compact bone on the edges. They're sandwiching a layer of spongy bone in the middle. All right, so technically most bones have some compact bone on the outside to make a fairly smooth edge and stuff like that. All right, and that's of course all the different sections of the bone that we talked about. All right, I thought I had one on types of breaks, but I'm not seeing it, so maybe not. Nope, guess not. Okay, so we'll go back. Go back to all slides and pick the one we want to go back to. All right, I'll go back here, I believe. All right, so we were last talking on number 9, underneath number 9 on the matching. Number 3 was a green stick fracture. We said that. Now, a fracture in which the bone is crushed. Okay, this is where pressure is put on it and crush the bone. This is more common like on your vertebrae because a lot of times it gets compressed. You get hit from the head and it crunches those backbones all together, or in the shoulders, it scrunches that backbone. That would be a compression fracture, or B. Okay, now not opposed to a depression where like it crushes in like your skull, and so it pokes it in or depresses it. Okay, this is compression where they get squeezed together and break. All right. Number 5, a fracture in which the bones then penetrate through the skin surface. Occasionally you see a really bad basketball injury or football injury, and they show the leg dangling out with the bone. They're getting better about not showing it over and over again like they used to. But yeah, that would be a compound fracture. You broke the bone and the bone is sticking outside the skin. It's more serious, mostly because you're more likely, well, one, it's obviously very broke, but also more infection and things like that could happen. All right, number 6, surgical realignment would be a open reduction, or F. And if your bones twist as well as breaking, then you get what we call a spiral fracture. Okay, and a spiral fracture is a little more serious because you're going to have splintering and stuff of the bone and a lot more little pieces that may not go in and want to heal quite right and stuff like that. So they may have to put plates or something in there to hold it together so it'll heal how they want. Which brings us to number 10. What are the steps in repairing a fracture? So when your bone breaks, remember you have blood vessels in here in the bone, and they break. They're going to bleed until you have a blood. It's going to swell up. You're going to have a lot of tissue, interstitial fluid, stuff like that, and blood, and it's going to swell. Okay, and that blood-filled swelling, or hematoma, that would be this first stage. Okay, that forms first. All right. Then the next thing is your body tries to start repairing things. It starts putting cartilage in here, and the cartilage comes in here and tries to hold it together, okay? And the cartilage holds it together, but they do not, are not solid. So that is what we call a fibrocartilage callus, okay? If you twist the bone, it can still break or come loose. So that would be a temporary fix. All right, now, once you get the fibrocartilage callus that holds it together, kind of splints the break together and gets rid of all the dead cells and damaged tissue and stuff like that. Eventually that may feel like it's fixed, but it's not really solid yet. So then the next step is you have to make a bony callus as the bony material replaces the cartilage, kind of like it did in your bones originally. All right, and now you get more of a bony callus there. Okay, now at that point you could take your cast off and you're ready to walk on it because it's enforced enough. But over time, this bony callus continues to get remodeled and fixed and modified, and as you walk on it, it pulls on it and strengthens the spot where the muscles pull on it again, kind of like we talked about earlier. And so that makes a permanent patch, and now your bone is officially healed. And you often hear people say, well, if you broke a bone, you're not going to break it there in the same place, and that's usually true because it's very strong and reinforced. All right. Notice I just skipped the picture, sorry. off your drawing. The first drawing was a green stick fracture where it splintered, but it did not completely break. The next column going across where it's sticking out is the compound or C fracture. Then below it, there's a simple fracture, G, where they're broken, but they're still inside the skin. And the last one on the skull where it gets poked in is a D or a depressed fracture. Okay? All right. Now, next question is, what are sinuses? Well, sinuses are things that get stopped up when you have allergies. But besides that, and making you sound funny in your voice like this, is they are open spaces in the bone. And they, first of all, lighten your skull, make your skull not as heavy. All right. And they're usually around the nasal area, but you have some sinuses down here, and you also have some up here above your eyes. Okay. If you have a sinus headache, that's usually there's some infection, or maybe these fill up with mucus and stuff like that. All right. They lighten the skull. They also help amplify your voice, and that's why your voice sounds funny when you're all clogged up. It doesn't amplify like it normally. It doesn't sound that way. All right. But their lining is continuous. Their lining connects to the nasal passages, and your throat. And so if bacteria get in your mouth or go up your throat or in your nose, they can go into these sinuses, and so they very often do get infected. All right. And the last one we're going to do is your hyoid bone, which shows right here is in your throat right there. It's kind of a U-shaped one. So it's in the anterior or front of the neck region. It does not attach to any other bone. It's attached to your tongue primarily and some other tissue back here, but it's not joined to any other bone, which makes it unique in your body. Most other bones are going to touch other bones. All right, even your kneecap, which kind of floats, at least touches your leg bones and is connected to your leg bones. But in this case, the hyoid bone is not. All right, its function is it anchors the tongue down, so your tongue is attached to something. That's always important, and so you don't swallow your tongue or whatever. It also allows you, it raises the larynx, and it allows you to swallow without stuff going down in your throat. It helps close off the larynx, and when you swallow, and it also allows you to speak properly. If you didn't have that hyoid bone, then that would cause problems with you trying to use your tongue and talking and things like that. So that's kind of its function. All right, and I think that is everything. We will take the weekend off. Monday we will not have a quiz. We'll have the quiz over these 12 questions on Tuesday. So have a good weekend and enjoy.